Welcome. Let's look at the anatomical planes and movements. But before we'll be able to study the anatomical planes and movements, we'll need to know the standard anatomical position. There are positions where the different parts of the body needs to be placed before it can be said to be in anatomical position. The anatomical position is a universal, standard, or specific anatomical positions that the body needs to be aligned in. Let's look at the different positions that specific part of the body needs to be before we can say that the body is in anatomical position. Firstly, the body must be upright, it must be standing straight, and the face must be facing forward. The upper limb must be on the side, so it has to be placed by the side, with the palm facing outward. So this is the way it is with this image here. You can see the upper limb is placed by the side of the body, while the palm is open to the outside and not facing inward. You can see that it is open to the outside and it must be placed by the side. Then the legs must be straight. You can see that the legs are straight. They are not bent or curved. And also the feet must be slightly apart. You can see that they are slightly apart and they are also turned outward a bit. So the different parts that are being highlighted, if they are being placed in the way we have listed, the body is said to be in anatomical position. This is a universal standard that is accepted by anatomists. The importance of the anatomical position. The anatomical position is a reference landmark that is used to study the different planes and movements that would be unfolding as we go with this lecture. When we talk about the planes and movements, for us to be able to execute action or also describe plane, the body must first be in anatomical position. The body cannot be in other form of position apart from anatomical position before we can begin to study the planes and the movement that we have in anatomy. So it is upon this that we'll be describing the different planes and movements that we have. So talking about anatomical planes first, we already said that the body must first be in anatomical position before we describe the type of planes that we have. So basically we have two types of planes. We have a longitudinal plane and we have the transverse plane. Longitudinal means it runs along the long axis of the body. Then we have the transverse plane, which is horizontal. So we'll be looking at these planes and see how they pass through the human body. So looking at the longitudinal planes, we have two. We have sagittal plane and we have the coronal plane. Let's assume that this is the body configuration. The sagittal plane runs along the longitudinal axis. We've already said this before. The sagittal plane can also be further subdivided into two. It can be mid-sagittal or median, or it can be parasagittal. For it to be mid-sagittal, it means it must run along the center. So the vertical plane must be drawn along the center, while parasagittal run longitudinally, but it is not along the center. So it means you have a line being drawn along this plane. This is sagittal, and specifically it is mid-sagittal because it's along the median plane. But if it is also vertical, but it is not running through the median plane, we call it parasagittal plane. Also to add that the sagittal plane tends to divide the body into the right and the left compartment. If you look at the mid-sagittal plane, it runs along a median course and it tends to divide the body into the right part and the left part. So also the parasagittal, even though they are unequal, but it still divides the body into a right side and a left side. Then going to the coronal plane, we said the coronal plane is one of the longitudinal planes. And how does this plane run along the human body? So let's assume that this is the configuration of the human body. So you have the coronal plane cutting it into the anterior and the posterior region. So it's not like the sagittal that tends to divide it into the right and the left. So let's say this is what will be creating the cut. So we already have the configuration of the body, then you have it cutting it, thereby dividing it into the front part and the posterior part. So you have a region in the anterior part and you have another region in the posterior part. Why the sagittal? tends to divide the body into a right and the left part. The coronal plane tends to divide the body into the anterior part and the posterior part. Then the second form of plane is the transverse plane. This is also known as the axial plane or the horizontal plane. This is how it's called. Let's say that this is the configuration of the body. And of course, the body is in anatomical position. So you have the cuts running transversely. So when the body cuts through the transverse section, it gives a superior and an inferior region. So it means that the region that is above the transverse plane is the superior region, while the region that is below the transverse plane is the inferior region. The anatomical planes are good tools in learning the structures of the human body. Different planes can be done on different regions of the body for studying because it tends to expose or review the structural content of those regions. Anatomical terminologies. We have different types of terminologies in anatomy, and it's good for us to also highlight this. We have anterior and we have posterior. Anterior means it is at the front, while posterior means it is at the back. We also have superior and inferior. Any structure that is located above the other is termed to be superior, while any structure that is located below the other, it tends to be inferior. So this structure is inferior to this structure, while this structure is superior to this structure. Then we also have median. Median means anything that runs along the center, just like the mid-sagittal plane. And this is what the median means because it runs along the median plane. We could also have medial and lateral. Medial means any structure that is close to the median plane. And any structure that is far from the median plane is lateral. So this is medial, while this structure is lateral. Then we have proximal and distal. Proximal means it is above, while distal means it is below. Then we could also have superficial and deep. From the name superficial, it means it is close to the skin or more to the exterior, while deep means it is deep into the body. Then we could also have superior inferior, we could have inferior medial, superior medial, and so on. And when we have this, all we need to do is to break the name down and taking what each of the components means and also bringing it together. So when we say superior medial, it means it is superiorly placed but medial. So it is close to the median plane, but it is superior. For this structure, the structure painted in blue is superior medial because it is superior to this, and of course it is close to the median plane. So when we see these jointed terminologies, it's just for us to break it down and interpret what each of the individual means, then bring them together. We also have basic movements in anatomy. And this movement, of course, can only be done when the body is said to be in anatomical position. We already described the standard anatomical position before, so that is what we'll be using to explain this movement. The first movement is flexion and extension. Flexion occurs when we reduce the angle between the bones. We have our forearm, we have our arm. Those are the two planes that we are considering during this flexion movement. So when we tend to reduce the angle between these two bones, we are flexing this joint, and this is called flexion. When we try to increase the angle, we are extending. So this is flexion and this is extension. This flexion and extension can also be done in different areas of the body. So you can try it out in the new joint. Then we have adduction and abduction. That's ADD and ABD. For adduction, we may take this as hard, that's to add to the body. When the body is in anatomical position, we said that the upper limb is placed by the side of the body. So when we try to do this, we try to bring the upper limb close to the body. We are adding it to the body. So this is adduction. Then when we are trying to take it away from the body, this is abduction. Then when you bring it close, it is adduction. When you take it away, it is abduction. And this kind of movement occurs along the coronal section because we already said that the coronal section divides the body into the anterior part and the posterior part. And it is by the side of the body, trying to create anterior and posterior division. So when you take the limb close to the body, you are adding it to the body. It is adduction. And when you take it away, you are abducting. We also have circumduction. Circumduction is a circular type of movement. And in this movement, there's a combination of 4 basic anatomical movements, which include flexion, abduction, extension, and adduction. And that is the way they follow with this movement. So we have this kind of movement. When the upper limb rotates this way, this can also be done using the thumb. When you try to rotate the thumb, so it's a circular type of movement. There is flexion, there is abduction because you are taking the limb away from the body. There is extension because you are extending the limb, and there is adduction because you are finally hardening it or bringing it close to the body. So there are 4 basic types of movements that the body tends to undergo when circumduction is being done. We have medial and lateral rotation. When you rotate it and bring it close to the body, this is medial rotation because you are bringing it medially. Then when you rotate it laterally, this is lateral rotation. And this occurs along the transverse plane. The medial rotation can also be referred to as the internal rotation because it's actually internal, it's coming inside. Then the lateral rotation is also referred to as the external rotation because it is going outside. Pronation and supination. For pronation and supination, this is the anatomical position of the hand. So when you pronate, it means you take the medial region of the hand. This is the medial part of the hand, and this is the lateral part of the hand. So it means you take the medial region of the hand, you take it away from the body, and this is pronation. Then supination is when you take the medial part towards the body, and this is supination. So you have the palm facing outward as supination. When it's pronation, it means the palm will face down and not upward. We have dorsiflexion and plantarflexion. This can be well executed between the foot and the leg. Let's say this is the foot and this is the leg. When you dorsiflex, it means you reduce the angle between the foot and the leg, and you can only reduce the angle by raising the foot. So when you raise the foot, this is dorsiflexion. Then when you try to increase the angle between the leg and the foot, it means you need to drop the foot down. So this is dorsiflexion and this is plantarflexion. Then you have the inversion and the eversion. Let's also take this illustration that this is the foot and this is the leg. When you take the medial side of the foot and you raise it, is inversion. Then when you take the medial side of the foot and you depress it, it is eversion. So you can turn it this way, inversion, you can turn it this way, eversion. Then we have protraction and retraction. Protraction is when you stretch the neck, then when you bring it back is retraction. So you can protract the neck and also retract the neck. Some, of course, we see this as a useful tool, maybe during cheating, and that is not good enough. Then we have opposition and reposition. This is the hand, this is the thumb, and this is the last finger. If we join the thumb and the last finger together, this is opposition. Then if we return it back, it is reposition. Returning it back, this is the way it is in anatomical position. These are the basic anatomical movements that we have, and we've tried to execute this movement for our understanding. Thanks for watching. Let's stay tuned.